Have you noticed that something which once happened naturally every morning has slowly become less common? Let me ask you an honest question. When was the last time you woke up with a firm morning erection without even thinking about it? For many men over the age of 60, that familiar morning sign quietly disappears over time. At first, it may seem like a small change, but the effects often reach much further than the bedroom. It can slowly reduce your confidence, affect your self-esteem, drain your energy, and even make you question whether your body is still working the way it once did. Many men simply accept it as another unavoidable part of getting older. But what if that belief isn't completely true? What if your body still has the ability to respond naturally, and all it needs is the right kind of stimulation to wake those systems up again? Today, I'm going to share a simple approach that doesn't involve medication, expensive devices, injections, or surgery. All it takes is your own hands, a few minutes each day, and 3 little-known pressure points that may help encourage healthier blood flow, improve nerve activity, and support the muscles responsible for natural firmness. I'm Dr. Jocelyn, a urologist who has spent the last 5 years helping men improve their urinary and sexual health naturally whenever possible. Throughout my experience, I've seen many men believe their best years are permanently behind them, only to discover that their bodies were still capable of remarkable improvement. Before we continue, I'd like to ask one small favor. If you find this information valuable, take a moment to press the like button so more men can discover these educational health tips. Also, leave a comment below telling me where you're watching from. I genuinely enjoy reading your messages, and it's always inspiring to see people from different parts of the world joining these conversations about men's health. Before we discuss the techniques themselves, we need to clear up one of the biggest misunderstandings surrounding morning erections. Most people believe they disappear simply because of age. They compare it to gray hair, wrinkles, or slower movement, and assume it's just another unavoidable milestone of growing older. While aging certainly influences the body, it isn't the complete explanation. In reality, morning erections often become less frequent because 3 important systems gradually change over time. Blood circulation may become less efficient, the nerves responsible for carrying signals may respond more slowly, and the muscles deep within the pelvic floor can gradually lose strength if they aren't regularly activated. Those 3 factors, rather than age alone, are usually responsible for the decline many men experience. The encouraging news is that these systems are not necessarily beyond improvement. Blood vessels can often respond positively to healthier circulation. Nerves can become more responsive when properly stimulated. Pelvic muscles can regain strength through consistent activation. In other words, your body hasn't completely forgotten how to produce a healthy erection. It simply needs the right reminder. Think of it as restarting a machine that hasn't been used in a while. The parts are still there. They simply need encouragement to begin working together again. That is exactly why these pressure points can be so valuable. Their purpose is to gently stimulate the pathways involved in circulation, nerve communication, and muscular support, helping your body remember the natural process it has performed for decades. To understand why these techniques may help, it's important to understand what actually happens inside your body during an erection. Many people assume erections occur automatically, without much thought, but they are actually the result of several systems working together with remarkable precision. Everything begins inside the brain, where signals are created either through physical stimulation, emotional attraction, or even the normal cycles that occur while you're sleeping. Those signals travel down through the spinal cord before reaching the nerves connected to the penis. Once those nerve signals arrive, they instruct the smooth muscle inside the penile tissue to relax. That relaxation allows the arteries to widen, making it easier for blood to enter 2 sponge-like chambers, known as the corpora cavernosa. As these chambers begin filling with blood, they expand in size. This expansion naturally compresses the veins that would normally carry blood back out of the penis. By temporarily reducing that blood drainage, the blood remains trapped inside the erectile tissue, creating the firmness, stability, and fullness that define a healthy erection. It is an extraordinary process that depends on excellent teamwork between the brain, nerves, blood vessels, and muscles. Unfortunately, as men grow older, 2 important changes often begin to interfere with this process. The first is that blood vessels gradually become less flexible than they once were. Healthy arteries naturally expand to allow increased blood flow, but with age, they may stiffen, making that expansion less effective. Reduced circulation means less blood reaches the erectile tissues, making firm erections more difficult to achieve or maintain. The second change involves the nervous system. Just like other parts of the body, nerve communication can slow down over time. The electrical signals traveling between the brain and the pelvic region may become weaker or less efficient, reducing the body's ability to respond quickly. When these two changes happen together, they create a powerful combination that explains why so many men begin noticing weaker or less frequent morning erections after the age of 50, 60, or even later. The important thing to remember is that these changes are influenced by biology, not simply by the number of birthdays you've celebrated. This is where targeted pressure point stimulation becomes especially interesting. Instead of relying only on medications or temporary solutions, this approach focuses on encouraging your body's own natural systems to work more efficiently again. By applying gentle, controlled pressure to specific areas, you can stimulate sensory nerves, encourage healthier circulation, and activate important muscles within the pelvic floor. Think of it as giving your body's erection mechanism a daily tune-up. You're not forcing anything to happen. Instead, you're reminding the nervous system and blood vessels how they are designed to function. When performed consistently, these simple techniques may help strengthen the communication between your brain, your nerves, your blood vessels, and your pelvic muscles. That coordination is exactly what supports stronger, more dependable erections over time. Let's begin with the first pressure point, known as the base groove. This area is located where the shaft of the penis meets the pubic region. You can think of it as the point where your penis connects with the rest of the pelvis, almost like a hinge that links several important structures together. To locate it, gently slide your fingers along the underside of the shaft toward your body. As you reach the base, you should notice a small groove or slight indentation. It may not seem like anything special at first, but underneath that small area are important branches of the dorsal nerve of the penis, along with blood vessels that contribute to supplying the erectile tissues. While this pressure point is often overlooked, it plays an important role because it sits close to several pathways responsible for sensation and circulation. Stimulating this region may help encourage blood flow while also providing sensory input that reminds your nervous system to remain responsive. You can also think of this area as one of the body's communication centers. It represents the place where nerve signals and blood circulation begin working together to support a healthy erection. When you gently stimulate this point, you're essentially encouraging your body to improve that communication. It's similar to turning the key in an engine before the vehicle begins moving. The goal isn't immediate results every single time. The goal is gradually improving how efficiently the entire system responds. Over time, regular stimulation may help reinforce those natural reflexes that contribute to morning erections and overall erectile function. Using this technique is very straightforward. Place your thumb directly over the base groove while supporting the shaft gently with your fingers. Apply firm but comfortable pressure, making slow circular movements over the area. The pressure should be deliberate enough that you can feel the tissue beneath your thumb, but it should never become painful or uncomfortable. Pain is not a sign that the technique is working better. In fact, excessive pressure may cause unnecessary irritation, so always stay within a comfortable range. Continue these slow circles for approximately 90 seconds without rushing. During that time, you may begin to notice a mild feeling of warmth, light tingling, or a subtle sense of fullness within the surrounding tissue. Those sensations often reflect increased circulation reaching the area. While every man's experience may differ, consistency is far more important than intensity. For the best results, make this part of your daily routine. Many men find it easiest to perform first thing in the morning, while others prefer doing it during a warm shower when the muscles are already relaxed and blood vessels are naturally more open. Either option can work well. The key is repeating the exercise every day rather than expecting dramatic changes after only 1 or 2 sessions. Just as regular exercise strengthens muscles over time, these gentle stimulation techniques work through repetition. With patience and consistency, you're helping retrain the body's natural erectile reflexes instead of depending on temporary solutions. Now let's move to the second pressure point, an area that many men have never considered despite its important role in sexual health. This point is called the perineum. It is the soft area located between the scrotum and the anus. Although it may appear to be a simple patch of tissue, beneath the surface lies one of the most important muscle groups involved in supporting healthy erections. Specifically, this region covers the bulbospongiosus muscle, a major component of the pelvic floor. During an erection, this muscle helps compress the veins that would otherwise allow blood to leave the penis too quickly. In simple terms, it acts like your body's own natural support system, helping keep blood where it needs to be in order to maintain firmness. When this muscle becomes stronger and more responsive, erections often feel fuller, steadier, and easier to maintain. This is one reason the perineum deserves far more attention than it usually receives. From a biological standpoint, gentle stimulation of this area may activate pelvic floor reflexes while encouraging the surrounding muscles to engage more effectively. From a practical standpoint, you're giving one of the body's most important support muscles regular activation without requiring any complicated equipment or lengthy workout. Many men focus only on improving blood flow, but healthy erections also depend on muscular support. Strong circulation brings blood into the penis, while healthy pelvic floor muscles help keep it there. Both systems are equally important, and this pressure point allows you to encourage both at the same time. Now let's talk about how to stimulate the perineum correctly so you can perform the technique safely and comfortably. Begin by sitting in a relaxed position or lying down with your knees slightly apart. This allows the muscles of the pelvic floor to remain loose rather than tense. Place 2 fingers gently over the soft area between the scrotum and the anus. Once you've located the spot, apply steady pressure that feels firm but never uncomfortable. You should be able to sense the muscle beneath your fingers without causing pain. From there, begin making slow, controlled circular movements. Continue this massage for approximately 2 to 3 minutes, keeping your breathing relaxed and your movements consistent. There is no need to rush through the exercise. Slow, deliberate stimulation is much more effective than pressing hard or moving quickly. If you want to increase the benefits even further, combine this massage with gentle pelvic floor contractions. As you apply pressure, lightly squeeze the muscles you would normally use to stop the flow of urine. Hold the contraction for a moment, and then completely relax before repeating. These gentle contractions help increase awareness of the pelvic floor while encouraging those muscles to become stronger over time. You don't need to perform intense or exhausting exercises. Small, controlled movements done consistently are often far more effective. As the weeks pass, many men notice that their erections begin to feel more solid, their control improves, and the overall response becomes more dependable. The improvement is usually gradual rather than immediate, but steady practice allows the body to rebuild strength in a natural way. Now let's move to the third and final pressure point, one of the most sensitive areas involved in sexual function. This point is called the corona ridge. It is the raised ring located where the head of the penis meets the shaft. Because this area contains an exceptionally high concentration of sensory nerve endings, it plays a significant role in transmitting signals related to arousal. Every touch in this region sends information through the nervous system toward the spinal erection centers, helping strengthen the communication between physical sensation and the body's natural erectile response. You can think of this area as an amplifier for sensory signals. When these nerve pathways remain healthy and responsive, your body is able to recognize stimulation more efficiently and react more naturally. From a biological perspective, gentle stimulation of the corona ridge helps activate these sensitive nerve endings, encouraging them to remain responsive over time. Healthy nerve communication is essential because erections begin long before blood flow increases. They begin with electrical messages traveling through the nervous system. If those messages become weaker or slower with age, the overall erectile response can also become less reliable. By regularly stimulating this highly sensitive region, you're encouraging those nerve pathways to stay active and responsive. It's similar to exercising any other part of the body. Regular use helps maintain function, while long periods without stimulation may allow responsiveness to gradually decline. There's also an emotional side to this technique that shouldn't be overlooked. Many men notice that as they get older, they don't just lose firmness, they also lose some of the natural sensitivity and excitement they once experienced. Activities that previously created an immediate response may begin to feel less stimulating than before. This can be frustrating and may even affect confidence or intimacy within a relationship. Regularly stimulating the corona ridge may help reconnect your mind with your body's natural responses, allowing that sense of spontaneity to gradually return. Instead of feeling disconnected from your own body, you begin rebuilding the communication between sensation, confidence, and physical response. The technique itself is simple and requires only a gentle touch. Using your thumb and forefinger, lightly grasp the raised ridge where the head meets the shaft. Apply comfortable pressure without squeezing aggressively. Hold the gentle pinch for about 5 seconds, then slowly release. Repeat this process for approximately 1 minute, maintaining a slow and consistent rhythm throughout. After completing the pinch and release phase, transition into slow circular movements around the entire ridge. Continue these circular strokes for another minute, making sure the pressure remains comfortable at all times. Remember, the goal is to stimulate the nerves, not irritate the skin. Excessive force offers no additional benefit and may actually create unnecessary discomfort. Gentle, controlled stimulation performed consistently is the most effective approach. When practiced every day, this technique helps condition the sensory nerves in much the same way regular exercise conditions muscles. You're gradually improving how efficiently your nervous system responds to stimulation. Over time, this may make it easier for your body to progress from mild arousal to a stronger, more reliable erection. Many men describe it as feeling like their body's natural response becomes smoother and more consistent. Rather than forcing an erection, you're helping restore the normal communication pathways that support healthy sexual function. Like every other technique we've discussed, patience is essential. Lasting improvements usually come through daily consistency rather than expecting dramatic changes after only a few attempts. Now that you understand each of the 3 pressure points individually, let's put everything together into one simple daily routine. The goal isn't to spend a large part of your day on complicated exercises. In fact, the entire routine takes only a few minutes, making it realistic for almost anyone to follow consistently. Start with the base groove. Spend about 90 seconds using slow, controlled circular motions while applying gentle but steady pressure. Focus on staying relaxed and allowing the surrounding tissues to respond naturally. After completing the first pressure point, move to the perineum. Continue with steady pressure and small circular movements for approximately 2 minutes. If you're comfortable doing so, add gentle pelvic floor contractions during this stage to further engage the muscles responsible for supporting erections. Finally, finish with the corona ridge. Spend about 2 minutes performing the pinch and release technique before switching to slow circular strokes around the entire ridge. When you add the time together, the complete routine requires only about 6 minutes each day. It's a small investment that may help support long-term improvements in circulation, nerve responsiveness, and muscular function. If you want to maximize the potential benefits of these techniques, don't rely on pressure point stimulation alone. Your body functions as one connected system, and healthy erections depend on several factors working together. One of the simplest habits you can improve is hydration. Blood is largely made of water, and maintaining proper hydration helps support healthy circulation throughout the body, including the blood vessels involved in erectile function. When you're dehydrated, blood volume can decrease, making circulation less efficient. Drinking enough water throughout the day is a simple habit, but it plays a meaningful role in supporting vascular health. Pelvic floor exercises can also strengthen the muscles that help maintain firmness. Gentle Kegel exercises performed correctly may improve the endurance and responsiveness of these muscles over time. Remember that the pelvic floor acts like a natural support system during an erection by helping reduce the amount of blood flowing back out of the penis. Stronger muscles often mean better support, improved control, and more dependable erections. Just as strengthening your legs helps improve balance and stability, Strengthening the pelvic floor helps support one of the body's most important functions. Nutrition is another piece of the puzzle that should never be ignored. Your blood vessels depend on healthy nutrients to remain flexible and function efficiently. Foods rich in natural nitrates, such as leafy green vegetables and beets, may help support healthy blood flow by encouraging the production of nitric oxide, a compound involved in relaxing blood vessels. Omega-3 fatty acids, found in foods like fatty fish, walnuts, and flax seeds, also contribute to cardiovascular health, which directly influences circulation throughout the body. While no single food is a miracle solution, building a diet that supports healthy blood vessels gives your body a stronger foundation for long-term improvement. When healthy nutrition, regular movement, hydration, pelvic floor training, and pressure point stimulation are combined, each habit supports the others rather than working independently. Think about it this way: you're training 3 essential systems at the same time. You're encouraging your blood vessels to deliver healthier circulation, you're reminding your nervous system to communicate more efficiently, and you're strengthening the muscles that help maintain firmness once blood reaches the erectile tissues. When those 3 systems begin working together again, your body's natural erectile response has a much stronger foundation. Instead of depending on temporary fixes that only address one part of the process, you're supporting the entire mechanism responsible for healthy erections. That comprehensive approach is one reason consistency is so important. Small improvements across several systems often produce much better long-term results than focusing on only one factor. At this point, some of you may still be wondering whether these changes are truly possible after many years of experiencing weaker erections. That's a completely understandable question. If you've gone a long time without regular morning erections, it's easy to believe that your body has permanently lost that ability. Many men assume they've reached an age where improvement simply isn't realistic anymore. But based on my experience working with patients, that assumption is often incorrect. The human body has an incredible capacity to adapt when it's given the right support. Improvement may not happen overnight, and it certainly requires patience, but gradual progress is absolutely possible for many men. Age influences the body, but it does not automatically eliminate its ability to respond, heal, and improve. The key is giving your body consistent opportunities to rebuild the healthy habits and biological responses that naturally support sexual function. Throughout my years of working with men of different ages, I've had the opportunity to see encouraging changes that many people once believed were impossible. I've worked with men in their 60s who thought their best years were behind them. I've met men in their 70s who assumed they would never again experience the confidence that comes with waking up to a natural morning erection. I've even seen men in their 80s make meaningful improvements simply by becoming more consistent with healthy daily habits and giving their bodies the support they had been missing for years. The progress didn't happen in a single day, and it certainly wasn't the result of one magic technique. It happened gradually, one day at a time, as healthier circulation, stronger pelvic muscles, and more responsive nerve pathways began working together again. That's why I always encourage my patients to focus on progress instead of perfection. Your body doesn't need miracles, it needs consistency. Every small step you take today has the potential to create noticeable improvements weeks and months from now. It's also important to remember that this conversation goes far beyond sexual performance. Healthy erectile function is often closely connected to your overall physical well-being. Good circulation benefits not only the penis but also the heart, the brain, and every major organ in the body. Strong pelvic floor muscles support bladder control as well as sexual function. Healthy nerve communication influences movement, sensation, and many other essential body functions. When you begin caring for these systems, you're investing in much more than intimacy. You're investing in your confidence, your energy, your independence, and your quality of life. Many men tell me that the greatest improvement isn't simply stronger erections, it's the feeling of knowing their body is responding again. That renewed confidence often carries into other parts of life, improving mood, motivation, relationships, and even the willingness to stay active and healthy. If you've been telling yourself that weaker erections are simply the price of getting older, I want to encourage you to look at the situation from a different perspective. While aging certainly brings changes, it does not mean you have no control over your future. Your daily choices still matter. The habits you build today influence how your body functions tomorrow. By spending only a few minutes each day stimulating these pressure points, staying physically active, eating foods that support healthy circulation, drinking enough water, and strengthening your pelvic floor, you're giving your body the best opportunity to perform at its highest potential. These are safe, natural habits that work with your body's biology rather than attempting to replace it. They require patience and commitment, but those qualities often produce the most lasting results. So here's the challenge I'd like to leave with you. Commit to this routine for the next 21 days without skipping. Perform the 3 pressure point techniques each day, stay hydrated, continue moving your body, and pay attention to the small changes you notice along the way. Don't judge your progress after only 1 or 2 attempts. Give your body enough time to adapt. As the days pass, you may begin noticing subtle improvements in sensitivity, circulation, firmness, or even the return of more consistent morning erections. Every man's experience is different, but consistency gives you the greatest opportunity to see meaningful results. Once you've completed the full 21 days, come back and share your experience in the comments. I'd genuinely love to hear how you're doing and celebrate every bit of progress you achieve. If you found today's information helpful, please take a moment to like this video so it can reach more men who may be searching for reliable health information. Be sure to subscribe as well if you'd like more evidence-based tips on men's health, healthy aging, urinary health, and natural ways to support your body. And if you know someone, a friend, a brother, a husband, or another family member who could benefit from hearing this message, don't hesitate to share this video with them. Sometimes one simple conversation can encourage someone to take the first step toward improving both their health and their confidence. As we finish today's discussion, I want you to remember one final thought. Growing older does not automatically mean losing your vitality. Your body continues changing throughout life, but it also continues adapting. With the right knowledge, healthy habits, and consistent effort, many men discover that their bodies are capable of far more than they expected. Improvement is rarely instant, but it is often possible. Stay patient with yourself, stay committed to your health, and give your body every opportunity to succeed. I'm Dr. Jocelyn. Thank you for spending your time with me today. I truly appreciate you watching, and I look forward to seeing you again in the next video. Until then, take good care of yourself and stay healthy.